Hello and welcome to Nurse's Handbook. Today I will be dealing with the quick analysis of some ECG strips. Question number 1. Identify the rhythm. Option A. Sinus tachycardia. Option B. Sinus bradycardia. Option C. Normal sinus rhythm. And option D. Atrial fibrillation. And the correct answer is normal sinus rhythm. Sinus rhythm is the name given to the normal rhythm of the heart, where the impulses are started at the SA node, which then passes through the AV node, bundle of His, bundle branches, and then finally the Purkinje fibers. Depolarization and repolarization of the atria and ventricles are shown up as three distinct waves, that is, P wave, which denotes the atrial depolarization, QRS complex denotes the ventricular depolarization, and the T wave indicates the ventricular repolarization. Number 2. Identify the rhythm. Option A. Sinus tachycardia. Option B. Sinus bradycardia. Option C. Normal sinus rhythm. And option D. Atrial fibrillation. And the correct answer is sinus bradycardia. Sinus bradycardia is not a changed rhythm. It is simply normal sinus rhythm which is slowed down, where the rate is less than 60 beats per minute. In an ECG, you will find that the RR intervals are same. There will be a P wave for every QRS complex, but the rate will be less than 60 beats per minute. There can be two main reasons for the bradycardia, that is pharmacological and non-pharmacological reasons. People taking beta blockers, calcium channel blockers, and in case of organophosphate poisoning, bradycardia may occur. These are the pharmacological reasons, whereas it can be seen in athletes and may also occur during sleep in some patients, which is non-pharmacological. If the patient is asymptomatic, then no active intervention is required. Question number 3. Identify the rhythm. Option A. Ventricular fibrillation. Option B. Atrial fibrillation. Option C. Ventricular tachycardia. And option D. Atrial tachycardia. And the correct answer is ventricular tachycardia. From the term itself, we can understand the origin of tachycardia is from ventricles. So in VT, we can see a broad QRS complex. And remember, these complexes are originated from the ventricles. The second very important thing to remember is that there is AV dissociation, means there is no relation between P wave and QRS complex. So in such ECGs, one will not find any P waves. The main causes of VT are ischemic heart disease, dilated cardiomyopathy, hypertrophic cardiomyopathy, and Chagas disease. Question number 4. Identify the rhythm. Option A. Ventricular fibrillation. Option B. Sinus tachycardia. Option C. PSVT. And option D. Atrial tachycardia. And the correct answer is sinus tachycardia. Sinus tachycardia is a regular cardiac rhythm in which the heart beats faster than normal and results in an increased cardiac output. The heart rate will be more than 100 beats per minute. In an ECG, you may find that RR intervals will be same and regular. For every P wave, there will be a QRS complex. All the waveforms will be present. Sinus tachycardia normally occurs after having an exercise in case of fear, stress, and pain, etc. Other causes may be hypovolemia, thyrotoxicosis, etc. Number 5. Identify the rhythm. Option A. Ventricular fibrillation. Option B. Sinus tachycardia. Option C. Ventricular tachycardia. And option D. Atrial tachycardia. And the correct answer is ventricular fibrillation. So firstly, from the word itself, it is clear that this is produced at the ventricles. So in an ECG, one may see chaotic, or we call it as disorganized waves of different amplitude, where the P wave QRS complexes or the T waves are not identifiable. The heart rate may range from 150 to 500 beats per minute. Ventricular fibrillation may be coarse or fine. Remember, VF is one of the life-threatening rhythms, and that is why it comes under shockable rhythm. There are two main causes of ventricular fibrillation, that is cardiac causes, which includes myocardial ischemia or infarction, cardiomyopathy, channelopathies, Brugada syndrome, aortic stenosis, myocarditis, cardiac tamponade, etc. And the respiratory symptoms are tension pneumothorax, pulmonary embolism, primary pulmonary hypertension, sleep apnea, bronchospasm, aspiration, etc. Question number 6. Identify the change in the ECG. Option A. Ventricular fibrillation. Option B. Anterior wall MI. Option C. Inferior wall MI. And option D. Lateral wall MI. And the correct answer is inferior wall MI. Whenever there is ST elevation, it indicates MI. Here in this ECG, you can see ST elevation in leads 2, 3 and AVF, which is suggestive of inferior wall. And the reciprocal leads of 2, 3 AVF is AVL. In this you will find ST depression. A point to remember is whenever there is a ST elevation in leads, the reciprocal leads will have ST depression. Question number 7. Identify the rhythm or change in the ECG. Option A. Ventricular fibrillation. Option B. Anterior wall MI. Option C. Hyperkalemia. And option D. Lateral wall MI. And the correct answer is hyperkalemia. Hyperkalemia is a condition where serum potassium level is more than 5.2 millimoles per liter. ECG changes generally do not occur until there is a moderate degree of hyperkalemia. In an ECG, one may find hyperacute T waves, or we call it as peaked T waves, followed by wide or flattened P wave with PR prolongation. Some cases of hyperkalemia may end in bradyarrhythmias or conduction blocks. Let us see the main causes of hyperkalemia. It can be remembered with a mnemonic that is KL, where C is for cellular movement of potassium, like in cases of burns and traumatic injury. A is for adrenal insufficiency, R for renal failure, E for excessive potassium intake, and D for drugs. Question number 8. Identify the rhythm in the ECG. Option A. Atrial fibrillation. Option B. Ventricular fibrillation. Option C. Atrial flutter. And option D. Sinus tachycardia. And the correct answer is atrial flutter. Heart rate in atrial flutter is usually faster, that is more than 150 beats per minute. The P wave in atrial flutter will be sawtooth, and that is one of the typical characteristic feature which helps us differentiate it with atrial fibrillation. Thank you for watching. For more updates like this, do like, share and subscribe the channel Nurses Handbook.